This brief covers the enrollment criteria for the Exceptional Family Member Program. Reference is the Army Regulation 608-75. The information you're looking for is in Appendix B. You can navigate there quickly using the search bar. There's a lot of confusion over the enrollment criteria. I would advise you to first consider reading Appendix B prior to enrollment. There are nuances that you will find outside Appendix B that may provide further clarification. Some of that information can be found on the 2792 form. When trying to determine if a chronic condition is warranted, I try to extract the intent of the wording. In Part A, it describes life-threatening conditions, chronic medical or physical conditions, and then gives examples of high-risk newborns or patients with cancer, sickle cell disease, and insulin-dependent diabetes. These appear to be cases that have fragile medical conditions. These are conditions that can escalate in severity very quickly. Based on the criteria explained in paragraph A, I rarely enroll people with hypothyroidism unless it is something more complex with positive antibodies or other autoimmune processes that are occurring. I rarely enroll people with essential hypertension, and I rarely enroll people with hypercholesterolemia unless they've had an event that would signify more complicated heart disease. The reason why I don't enroll people for these chronic conditions is because a primary care provider can typically manage these without difficulty, and the medications to support these diagnoses can normally be obtained at any MTF. If a medication is special order, that may be a reason to enroll the patient. In paragraph B, it starts to talk about mental health conditions, and it specifies a diagnosis of bipolar, conduct, or major affective disorder. We have treated mental health quite conservatively over the last decade, so any mental health diagnosis that has required monthly visits for the last 6 months. A mental health diagnosis is considered for 5 years, not just the last 3 years. Although attention deficit disorder is not included in the paragraph that describes mental health conditions, it is documented on the 2792 under the mental health portion. We are really looking for ADHD symptoms that go above and beyond the routine ADHD. So a child who is younger than 5 and diagnosed with ADHD would likely warrant enrollment into EFMP. And it also specifies children with comorbid psychological diagnoses, which can be common with anxiety or depression. Any ADHD diagnosis that requires multiple medications other than the stimulants, or a high dose of stimulant. With the diagnosis of ADHD, line 3 and line 4 discuss the treatment management by mental health providers and other subspecialists. Note that sometimes we have patients being seen by a child psychiatrist or other subspecialists, but the 2792 is really requiring minimum care required. Therefore, it may be appropriate to transition their care to a general medical officer or other PCM to manage their ADHD. If that's the case, then they would not require an enrollment in EFMP. Paragraph C covers the asthma diagnosis. This would include bronchiolitis as seen in younger children. I oftentimes see dependents enrolled in EFMP for the diagnosis of asthma for up to 5 years. If you look closely at these criteria, there is no stipulation for a minimum of 5 years. Dependents who are scheduled daily inhaled bronchodilators or anti-inflammatory agents qualify for enrollment for EFMP. If there has been an admission to the emergency department or acute visit to the clinic for asthma exacerbation within the last year, this would also warrant an enrollment. You may also consider the use of oral steroids significant enough for an exacerbation. If the person has been admitted to the hospital or has been admitted to the intensive care unit in the past 5 years, then the enrollment is warranted for a minimum of 5 years. Let's pick up at paragraph E. Paragraph E represents a patient who may not have acute symptoms or problems, but chronic problems that require more medical care. In this paragraph, we're looking for people who would require durable medical equipment assessment and maintenance as well as changes. These patients would simply be enrolled based on whatever the diagnosis is that is associated with the adaptive equipment being required. Paragraph F is requiring assistive technology devices be a criteria for enrollment. It may be important for people to realize that the schools may use a communicated device. In this case, they would have an enrollment under the educational addendum, the 2792-1. If the educational component of the 2792-1 does not clearly delineate the use of assistive technology, then this must be placed in the medical portion of the 2792. Under paragraph G, the use of housing modifications such as air conditioning or a HEPA filter implies that individuals with severe allergies would also require an enrollment into EFMP. It may be necessary to demonstrate some type of testing, such as RAS testing or skin testing by an immunologist. A person who is receiving immunotherapy on a monthly basis would also indicate an enrollment need. Section B of Appendix B discusses the special education needs. In most cases, the school will complete this paperwork for you and supply an IEP to the case coordinator. During the summer months, when the school is not in session, the primary care provider may be required to complete the 2792-1. A copy of the IEP is certainly helpful in clearly articulating the needs within the school environment on the 2792-1. In summary, I think it is important for people to review the criteria and extract the intent of the criteria to communicate their medical needs so that appropriate placement within the military environment can be established. We don't want to move a person to a remote location in which their medical needs cannot be supported adequately. When in doubt, it would be helpful to articulate the special needs in writing under the comment section. Ideally, the people at a gaining facility would review the 2792-1 to help the Human Resources Command decide on appropriate placement.